myself here. My name is Juanita Retram, and I am the Business Office Manager at Four Winds Manor here in Verona. And along with me today, we have Heather Mortensen. Heather is the Director of our Rehab unit at Four Winds. So first of all, I just want to say thank you to Becky and to the Senior Center for having us come out, and I'm glad that the weather's working with us. A beautiful day to come out, so it wasn't too cold, so glad to see everybody was able to make it. I understand that one reason Becky had wanted me to come over, and Heather, is I understand we've got some questions out there as far as maybe coverage with Medicare. You're hearing a lot in the news these days about Medicare coverage, observation stays, inpatient stays in hospitals, and how does that kind of all work if you were to have a need to go to a skilled nursing facility. What I have actually done is, Heather actually handed out a couple different forms, and I'm just going to kind of start out with. And if you guys have any questions, don't be afraid to ask. That way, I kind of know what it is that we need to be talking about. The first one is the Centers for Medicare and Medicaid Services. Before I go to that, I would assume that some of you have probably received the Medicare and You Handbook 2014. The Medicare fact sheet that's also came out, a lot of that came directly from this book, okay? But what we like to do is when folks come into Four Winds, we kind of summarize that book, and we just kind of put it into a fact sheet that we give to everybody. And if you have any questions, we certainly can answer those as well. So with that moving forward here, I'm going to look at the Centers for Medicare and Medicaid Services, the form that we handed out to you. And as I had mentioned, there's a lot of discussion out there about hospital inpatient or outpatient, and how does that affect going into a skilled nursing facility. Lately, what we're finding is there are a lot more hospitals are putting folks in what they call an observation stay. An observation stay in a hospital, the doctor has not formally admitted you by a physician orders to be as an inpatient stay. So folks are in technical difficulties.
Oh my gosh, I'm so sorry.
But many folks do not realize what that difference is. And it's, it says here that in order to be admitted as an inpatient to the hospital, the doctor has to write an official order stating that you're inpatient. In order to receive Medicare Part A coverage, as you all know, there's different parts to Medicare. To receive Medicare Part A coverage in a skilled nursing facility, you need to have, the very first requirement, a 3-day hospital inpatient stay. And don't be afraid if you ever are in the hospital or somebody that you know goes to the hospital and you're there overnight at the hospital, don't be afraid to ask, am I here under inpatient or observation? You do have that right to know, because many folks do not realize that they're there for observation and not inpatient stay. Okay?
Okay, so you ask and they tell you you're here for observation. Do you have any recourse?
What you can do in that situation is have them explain to you why they have you as an observation stay versus an inpatient stay. As far as the recourse goes, because I don't work in the hospital setting, I really would not have a clear answer for that, but don't be afraid to ask as many questions as you can directly to the staff there, so that you have a clear
How long can they
understanding.
keep you in observation?
Well, it's been our experience that we've actually had folks that I can think of one case where we had somebody as an observation stay for 7 days.
And that is enough?
And that is a very long time to be categorized as observation. I guess my personal feeling is if they can't categorize you as an inpatient within those first couple days, I don't understand the reason as to why they keep you as an observation stay. On the back of this, there's actually some examples on page 3. They actually give you situations, where it's going to put you into an observation or an inpatient stay, such as a case here. You go into the emergency department, and then you're formally admitted to the hospital with a doctor's order. And that's where I was going with. You have to have a doctor's order to be categorized as inpatient. And as long as you have that doctor's order categorized as inpatient, then Part A will pay while you're in the hospital. And then if you have those 3 days of inpatient stay, then you can then, as long as you're gonna need some follow-up rehab, skilled services, you'll be able to go into the skilled nursing facility. And if you have the days available on your Medicare Part A status, you'll be able to be covered by Medicare Part A in a skilled nursing facility. Say if you just visit the emergency department for a broken arm, you get x-rays and a cast, and you go home. Obviously there is an outpatient case. Medicare A would not pay anything, but your Medicare Part B will kick in to cover some of your doctors and some of those supplies that you use, or x-ray services and things like that. You come to the emergency department with chest pain, and the hospital keeps you for 2 nights for observation services. Again, there's that key word, observation. So you're considered an outpatient patient, not inpatient, to get those benefits. You come to the hospital for outpatient surgery, but they keep you overnight for high blood pressure. Your doctor has not written an official order, so therefore you're an outpatient. Your doctor writes an order for you to be admitted as an inpatient, and the hospital later tells you they are going to change your status to an outpatient. Your doctor must agree to that and be in the hospital, and in the hospital must tell you in writing while you're still in the hospital that your status has changed. That has been done as well, where they'll categorize you as an inpatient. Again, I'm not in the hospital setting, so I really don't know all the criteria, what that determination is, but they can reverse that as well. And it's important to be done while you're in the hospital. One of my positions and what I do for folks coming in when we get referrals from the hospital is that is my primary thing that I do. I check the benefits of everybody that comes to our facility that's referred to us, and I always make it a note. I have got to call the hospital, and I always speak to the billing department, because you can talk to social workers, medical records, billing departments. I always go to the billing department just because that's where my expertise is, and with the billing, they know right away if it's been categorized. And sometimes when we get referrals, it may say inpatient, but until I make that phone call, I find out something different. So then I have to figure out, or they will tell me what the first day of inpatient is to meet that 3-day criteria to go into the skilled nursing facility and be covered by Medicare Part A while there.
What's the financial reason why the hospitals are using observation status more than
I think a lot of it has to do, and again, I really shouldn't say for sure because I don't really work in that hospital
From your
setting.
limited experience, what you found to be true?
Sometimes it depends on your diagnoses. Whatever they categorize your diagnosis as, will categorize them as being outpatient or inpatient. As far as the financial, that's, CMS is working on that with the hospitals right now. I don't know if there's anything, Heather, that you can kind of input to that. Some days I kind of wish I'd go to the hospital and learn, some of those questions as well, and the answers to those questions. But I do know that Medicare is looking at this particular area of these observation and inpatient stays.
I don't know if I've read or heard, but if a person has too many repeated admits to the hospital, then the hospital is penalized financially from Medicare. The questions are raised, or
It does
there's
raise,
some price the
I
hospital
call them flags. It will raise flags, and that is, you are 100% right. Right now, admissions, readmissions back and forth to the hospitals is very high on the list as far as what they're looking at. And I know that's also one thing that we as a skilled nursing facility, we look at that too, that make sure that when we're sending people out, that we are keeping that in the back of our mind, that, if we can take care of them in the facility versus having to send them out, we will do what we can to do that. You know, it all kind of depends about the doctor's involvement and the doctor's orders and things like that as well. So,
Is that observation category something fairly new?
observation has always been around. It's just that right now we're seeing it a lot more and more. You know, it's unfortunate, to me, truly, it's unfortunate because sometimes, you know, observation stays, then people may decide to maybe go home and get home health involved or something like that. Nothing against home health, nothing against anything like that. But sometimes I think the benefit that they could come into skilled nursing facility and receive therapy is much better off than send them home, because then they can get the daily therapy, and whereas home health, I think, is only limited therapy.
If a person goes home, typically your home health therapy is gonna be 2, maybe 3 times for the week. Whereas if you spend even a short amount of time, even a week short-term rehab, and you get that therapy 5 to 7 days while you're there, that's gonna put you at a higher level than if you're at home, you know, seeing somebody only 3 times a week. Plus you have the 24-hour nurses there if something were to happen, you know, even if it's for a week. Granted, people don't, you know, I think the connotation out there is that I'm not gonna go to a nursing home, that's where people go to die. But I think more people need to be aware that, no, I can go for a week, I can get rehab, I can get nursing care, and I can go home and save myself from going back into the hospital or getting sicker or, you know, something else happening at home, so.
And two, I just want to touch on the base that, okay, say the hospital has categorized you as an observation stay. Can you still come into the skilled nursing facility? Absolutely. That's when we take a look at what other kind of benefits you might have, other types of insurances. Many people have a rider on their insurance policies where it's under the Wisconsin state mandate benefit. You know, there's a possibility of getting some additional help, not full coverage, but there's additional help, maybe getting that from your insurance company, that they would review that to see if you qualify for those services. If you come into the facility and it's from an observation stay, if you have both Medicare Part A and Medicare Part B, your Medicare Part B will take care of the therapy. Medicare Part B, as you probably, some of you are aware, covers 80%, and then the 20%, you know, after your Part B deductible has been met, then your 20% would be your responsibility, or most folks have an insurance company that will, an insurance plan that will take care of that 20%. So it's just the Medicare Part B side will cover the services versus the all-inclusive Medicare Part A. So don't get the conception that observation stay, you cannot go into a skilled nursing. You can still go, but we always let people know prior to, when they come into our facility, what your benefits are and what we can help with you guys as far as your insurance and coverage, things like that. So is there any other questions as far as observation versus inpatient? I thought this CMS memo that you each got a copy of, it really does kind of explain, you know, how it all works as far as the 3-day hospital stay versus observation stay and things like that. I don't know if there's any more questions related to that.
The patient, when they're in the hospital, they're not going to know which status they are unless they specifically ask.
That is correct, either the patient.
They're gonna be in the same place, the same rooms, getting the same care. You're not off on the other wing or something,
Correct.
so you could very well not know.
Correct, and that's why I say it's, you know, patient or a family member, if you've got somebody that's helping you, always ask the question, because many people, I'm sorry to say, many people do not realize that until it's after the fact. And they're getting ready to be discharged, and the social worker talks to our social worker, and then that's when we find out it's observation stay, and then we have to go back to the patient. Maybe that patient was not aware of that all along. So it is important for you and or a family member to ask those questions. Am I inpatient, or am I observation? That's your rights to ask that question. And they have to make that determination while you're in the hospital, should they change it. So if there's no other questions as far as observation or inpatient, I actually do have my business card up here that you guys are more than welcome. I'm going to give you a card. I am always willing to help out people, but if you have questions, I can't direct you on, you know, on certain things. But as far as many folks that have left Four Winds Manor and have gone home, I've actually had those folks just call me or their families just for, some input, if there's anything I can do, because people talk to me about long-term care insurances and all kinds of things. The other, we kind of move aside from that a little bit. I don't know, Becky, if this is something that you get questioned on or not, but I just want to touch a little bit on Medicare replacement policies. I don't know if any of you folks are familiar with those, have any of those. I'm not going to touch base along on that, but I just want to caution everybody on Medicare Part A replacement policies. Are they good policies? They're good policies. And the reason why the Medicare Part A replacement plans came out is because when Medicare Part D came out for your pharmacy and things like that, all that kind of came together with these Medicare Part A replacements. But the reason why I want to bring Medicare Part A replacement plans up is I just want folks to know that it's overriding your regular Medicare. You're giving up your regular Medicare.
How does that contrast with an Advantage plan? Is that what it is?
Right, it's a Medicare Advantage plan. Those are Medicare replacement plans, that is correct. But I have had many folks come in with that and not realize that they have given up their regular Medicare benefits. So I just kind of want to, like I say, just kind of throw that out there. We have Medicare Part A replacement plan folks at our facility, but we've had people that are really surprised when I am the one. Sometimes I have to be the bad bearer of bad news. Well, you gave up your regular Medicare, so you have this. So we've had people that have actually, really looked at their policies. And many times what happens is folks are approached and they don't have any assistance, like family members and things like that, that help them understand what some of these things are. So, again, unfortunately, they come into, I'm the one that explains those benefits to them, and sometimes they're quite surprised what that will or will not do. So, Medicare Part A and Part B, look at supplemental plans that'll go through with the co-insurance and things like that. So, but like I say, I just want to touch just a little bit on the Part A replacement plans because people do not always realize what those are. And they might have some different out-of-pocket expenses compared to regular Medicare and things like that. So, I talked a little bit about, the coverage if you go into an observation stay when you come into the hospital. I touched base a little bit about the 30-day mandate that some of the insurance companies do offer.
What's that?
It's called a Wisconsin State Mandate Benefit. Some insurance companies in the state of Wisconsin, if you do not meet the Medicare skilled criteria, then what that insurance company will do is they will review your skilled criteria to see if it meets their skilled criteria. And a Medicaid 30-day benefit, they will review maybe your therapy caseload, which is the norm. They'll review the therapy caseload and make sure that you're still meeting their criteria with that 30-day mandate benefit. And basically what that is, it only covers a portion of your stay, not everything in full. They reimburse they reimburse facilities at the DHS or the Medicaid rate. And so that's what a 30-day mandate, that's a good.
This is an insurance you have to purchase in advance?
No, it's actually, with your current insurance company, you can just ask them, do you follow the Wisconsin State 30-day mandate benefit? Some folks, it's a rider to their policy. They don't realize that.
You
They
mean,
don't.
when you say your current insurance, that would
Mhm.
mean if you have a supplemental plan, that's.
If you have a supplemental plan, you can ask them if they have a 30-day rider policy. Some folks, I'm just going to use an example, they have Dean Health Plan, and they have come in under an observation, after an observation stay. We check their benefits, and their part of their Medicare supplement plan may have an addition or a 30-day mandate benefit where they will look at the records on a weekly basis. So that's always a good question to ask your insurance company. The policy I currently have, does it follow the Wisconsin State 30-day mandate benefit? Which I really think is important, especially now with all these observation stays out there. I think it's your guys' right to really know what your insurance benefits are. And, you know, some insurance benefits are old policies, you know, make sure they've been updated. Some riders that may not have been on your current one that you never signed up for years ago, but you may consider wanting those now. So,
What did you call that again? 30-day?
it's Wisconsin state mandate, 30-day benefit.
So you said the Dean Care Gold policy does have that, or doesn't?
I did the Dean Health Plan, I don't specify the different plans, because I know there's different plans, but, because some people have gold, some have, just the regular Medicare supplement, there's different plans with Dean, so that's why I just threw Dean Health Plan out there, because there's certain ones of their
Some do,
policies.
some don't.
Exactly, exactly, yeah, and I don't wanna misquote which one does and which does not, so. Anything else? We talked about the hospitalizations, a little bit about Medicare replacements, the additional 30-day. Anything else that you guys have any questions on as far as for me and the Medicare insurance billing world? I can certainly try to answer. I don't know if there's anything else that, Becky, you're getting questioned on from some folks around here, or?
I think the observation was just, I know that having worked, when I worked in the hospital, a lot of times the insurance company will request that the stay is changed to observation at some time the insurance company will be in contact with the case manager following that patient in the hospital, and sometimes the insurance company will say that needs to be changed to observation. I don't know if it must be for billing purposes, and I'm not sure. That's not always the case, but I know
This is
that.
well after the fact, right?
This is while they're in the hospital.
While they're
in the
They
hospital,
have to
yeah.
make that determination while you're in the hospital.
Yeah, yeah, so, but, yeah, I think the observation was been a huge question for people
Okay.
lately.
And like I say, Becky,
Thank
I don't
you.
know, if anybody does have any questions.
Yeah.
I mean, I can give them, like I'm doing right here. I
Yeah.
can tell you as much as I can, and you can certainly, I'd be happy to talk to folks. Not a
Super.
problem.
Thank
Because
you.
like I say, I've had folks that have come in for rehab, and they've actually gone back home, and they called me up, and I know especially, not so much with the observation questions, but I know with the Medicare replacement plans, a lot of people have, called me, and long-term care insurances, I get questioned on that, and things like that too.
Can I ask a question while they're sitting here listening?
Do I have to answer you?
Well, I know the answer, but I'm just now sitting here. So there's an appeal process for different levels of Medicare. So if the observation stay, they make that determination in the hospital. If after the fact, people don't agree with that or they don't realize that, is there an appeal process for that as well?
So if I'm understanding your question right, Heather,
Mhm.
are you talking if somebody comes into our facility
Mhm.
from an observation stay? I have had a case where we actually did have somebody that did appeal that because they did what I call a demand billing to
Mhm.
Medicare. We actually did have an observation appeal process, and unfortunately, that person, we sent in all of our records, they requested the hospital records, and my last findings was that Medicare stuck to it. They did not have a 3-day inpatient stay, so therefore, Part A did not cover for the skilled nursing facility. But at the same time, I do believe they requested the hospital records, because it only makes sense to me. They're coming into our facility, they still want to have Medicare review it, they want Medicare to review the stay in the skilled nursing facility, and it's because of an observation stay. To me, it only makes fair that they should be checking the hospital records. And, because we have had a case where I've actually recalled doing that. So I would, absolutely, I would question it. It's your right. It's your right. So, actually, that's a good question, because, yeah, I have had that. So if you have nothing else for me, like I say, I'm gonna leave my cards here. But I'm also going to just kind of turn over to Heather. Heather Mortensen is our rehab director at Four Winds Manor, and I have to say, she makes rehab fun. They have a great team down there, and some days I think I just want to take my lunch and go down there and have therapy with them. We do have a good time.
We do make it fun. That's part of, you know, when I think the team at Four Winds, overall, I think the whole facility tends to, you know, think fun is part of the healing process. Laughing and smiling and having fun is part of that whole process. And like I alluded to before, I think the negative connotation may be out there about a nursing home and rehab and that sort of thing. But, you know, we see lots of people that go out for a knee replacement. They may need just 3 or 4 days. They may need 2 weeks. They may end up there a month or two. So it really just depends. But they're getting that quality of care afterwards, where they have nurses looking out for them, social workers giving them resources, you know, therapy, doing the necessary therapy, rather than just going home and maybe possibly waiting 2 or 3 days before your home health therapist even gets to you, or waiting 2 or 3 days before your outpatient therapy appointment. You know, what if there's an infection? What if there's, you know, your pain meds are wrong? What if, so there's all these what ifs when you go home right after the hospital, and I guess we feel like, you know, doing a short-term rehab stay, you kind of take away all those what ifs, and kind of get you back on your feet a little bit safer and maybe a little bit more quickly than having something go wrong at home. And we do try to make it fun so that it doesn't seem like you're, you know, away from home any longer than anybody wants to be away from home. With the goal being, you know, to get you home as independent and safely as we can, as quickly as we can. We've had people there as short as, you know, 2 or 3 days, and then they're home, but they're at a much higher functional level than if they would have just went home, you know, right away after, you know, post-operative care. We see quite a few cardiac patients. Really, to me, that's very important to have that nursing care as well after a cardiac surgery or any cardiac issue that may have come up. We also see people that have pneumonia and they just need a few days to recuperate rather than going home and everything is much harder than it used to be. It takes a lot of time to build something up. It takes much less time to decondition. And I think people forget that process. You can decondition overnight when you're in the hospital and you're not moving as much as you can at home. And it unfortunately takes a few more days to build that up to the point where you were before a hospital stay. So any questions on, you know, short-term rehab or things to expect if you're planning a surgery? I have some pamphlets over there on the table about orthopedic stays, cardiac stays, kind of the length of stay that an average person would stay, kind of where they started. There's a couple graphs on the back of those where people start and where they end up. Sometimes they're even a higher level than when they were at home prior to anything happening. So I think it's, you know, a good idea for people to really consider that when they have a hospital stay or a surgery or anything like that.
Are you doing therapy 7 days a week?
We do therapy 7 days a week on, you know, kind of a diagnosis basis.
I've got a question. I'm looking on page 2 where it talks about Medicare pays so much and the patient pays down, kind of down towards the
Are you on the
bottom.
Medicare fact sheet?
Yes, Center for Medicare and
Uh-huh.
Medicaid Services, page 2. It says the first 20 days Medicare pays 100%, you pay 0, and so on and so on.
Mm-hmm.
Is that conditional on, I mean, like, it's up to 100 days where Medicare will pay at least part of it. Is that on the condition that you're showing some progress?
Absolutely, very good question.
It's not just flat out, you can stay 100 days and never
Yes,
pay for it.
very good question. That's actually perfect because you are correct. As long as, you know, Medicare will continue to cover your stay in a skilled nursing facility under Medicare Part A, you have got to be showing a daily progress. You know, if you could, because when therapy, and I shouldn't be speaking, you know, for Heather here, but she can certainly speak on it as well. When therapy starts seeing you, they set this goal, okay? So they're going to do everything they can to show you continuing to make that goal. And that is absolutely, if you're making your goals, but then all of a sudden, if you're kind of at a plateau, is what the word we use, just like you did, you know, then we have to start saying, well, you're plateauing, for some reason, maybe something has changed, you're not ready to go home yet, But something has changed, you're not increasing, you're not decreasing, then that's a determination that will need to be made by our therapy staff, if that's why you're there. Then Medicare may need to, at that point in time, Medicare will probably not cover your stay any longer. We have folks, an example, Heather, if you want to, weight bearing status. That's a very good example. Sometimes there's only so much therapy if you're on a non-weight bearing status that therapy can work on. So we've had different kind of situations where either people,
Sure.
they might decide to go home, and or they can't go home for some reason, they'll stay in the facility. And with Medicare, you have to, it's within a 30-day rule. If your weight bearing status would change and you're still in the facility, within 30 days, Medicare will just continue on whatever day you left off, okay? So there's different things there a person can consider too. So that if you do not go home, you stay in the facility, and like I say, we know, your weight bearing status is going to be changing. You may decide to stay there, and then we'll put you back on Medicare Part A service, and then therapy will start working with you again to work with those goals.
So I mean, does it happen very often that a patient can stay in the facility for 100 days and continue to show improvement? That seems like such a long time.
It does happen, not frequently. I would
100
say.
days is very hard, to get.
Right.
It really truly
Yeah.
is. You have to be very compromised to get 100 days, but.
An example, that I can remember is somebody that was completely independent at home and had a pretty significant stroke.
Independent, you said?
Pretty independent at home, meaning they're not walking with a walker or a cane, they're driving, they're getting their own groceries, maybe volunteering, working in the community, and then, a major stroke has happened. Those particular people sometimes will use the 100 days because we've gotten them shortly after the stroke, and we can take them and they continue to show that progress. I'm trying to think of another example. Our average length of stay right now, and it varies depending on, of course, what patients we have and what diagnosis. I would say our average length of stay for any rehab patient right now is probably 21, 22 days, depending on, what the diagnosis is.
But as long as there's 30 days in between hospital admission, say somebody used their 100 days up, like that stroke patient, and then went home and was home, and a couple months later had something else happen and needed to be readmitted, then then they get their benefit that starts over again.
There
correct?
has to be, from their 100th day, there has to be a 60-day non-skill break.
Okay.
If you've used your 100 days, you have to have a 60-day of non-skilled services, meaning, say, skilled services mean you go in the hospital, that's a skill, okay? So that can interrupt those 60 days. So, but that's the main one right there. If you've used your 100 days, you need to have that 60-day break of non-skilled services.
Oh, and hospitalization can't count in that 60.
The hospital, if you go into the hospital 1 or 2 nights and you go home, then you have to take a look at that, because that's going against your 60-day break.
So you could receive services at home from a provider?
You could then receive services like from home health or something like that at home, yes. And home health is not part of skilled. Home health is separate from skilled services.
Any other questions?
Very good, very informational.
Was that informative and kind of answered
Very
some
much.
questions out there?
Very, very much,
Good.
yeah.
Good, because it's a very complicated world. It truly is when it comes to all of this.
Yeah.
And there's a lot to, and if you're a patient and you don't have family members helping you out, it makes things even more difficult for you too.
Yeah.
So, yeah, it's a lot to undertake.
Thank you, guys.
Well, you're welcome.
Anything
Thank you
else?
for having us.
Thank you so much.